धन्यवाद सर।
वो शिफ्ट कर रहे हैं हमारे नए उसके।
बहुत बहुत आभार सर आपका सभी का। अब हम अपने 998th वेबिनार में, we are now entering into 998th webinar of AYUSH Samriddhi. This October month is particularly breast cancer awareness month. Dates are changing between 19, 20, 21 and different dates are there. But definitely the serious concern is there because the cases are being increased day by day. So now breast cancer is definitely a serious concern. So without wasting much time, I would like to welcome Dr. K.C. Priyadarshini ji and Vaidya Madam Parul Joshi ji. Welcome, Madam. Thank you very much for joining within short notice. So kind of you, and please join for tomorrow's celebration 1000. Thank you very much. Now, I would like to request Professor V.K. Agnihotri sir for very brief preamble.
Thank you, sir. Thank you, Professor Pawan Sharma ji. I welcome all the guest speakers of today's this webinar, which is we are focusing over the breast cancer. And as per protocol of pink color, I just changed my T-shirt so that I should be disciplined enough to be a part of this webinar, having a pink shade T-shirt. And our Dr. Gurunatne ma'am from Sri Lanka, along with our Professor Parul Joshi ma'am, these both are the pillars of their subject, irrespective of breast cancer or any problem. This thing, so our good fortune.
Unmute करिए।
So with these words that this cancer, breast cancer is a very common and nowadays much prevailing. So it's a very important that your guidance will go a long way for the young chap, of course, even unmarried girls, married girls, and also having issues, not having issues, or delayed in pregnancy and all that. All these things they covered. And very, very important point is for this breast cancer awareness month is carried out. That is to assess, to self-assess the self-breast examination. That reveals so many things. So that is very, very important. So I think with these words, our stalwarts are here, and they will pour the whole knowledge and experience to this platform in this today's topics connection. Thank you so much, and over to Pawan Sharma. Namaskar. Again, welcome.
Thank you very much. I would like to invite the pillar of AYUSH Samriddhi also, Dr. K.C. Priyadarshini. Welcome, madam. Welcome. Yes. Your PowerPoint is visible.
Hi, everyone. Good evening to all of you.
Good evening.
All dignitaries on the dais and off the dais, and distinguished guests and all the participants. Today, actually, I'm so happy to present this presentation as a lady, breast cancers, Ayurveda care. Then these are the bird view of my topic: introduction, Nidana Chikitsa, Patya, summary, and conclusion. Then first we have to see how do all cancers beginning. Actually, what is the cancer means? That cancer also start from a cell. Normally, our body are made up of more than 100 million of cells. But cancer cells started with changes in one cell or small group of cells. That means whatever the cells we have, that is maybe increasing the size and the number of cells. But in cancer, they have unusual shapes and unusual growth, usually having just the right number of each type of cell, all the types of the body. Then what are the common causes of cancers? Because of our dietary habits, physical activities, virus and other infections, then sun and other type of radiations, then smoking and tobacco. Then what are the common cancers of the world? This is, I have taken 2020, and it actually telling that new cases detected. Here you can see that breast cancers 2.26 million cases, but other all are less than the others. That's why we have to talk about the breast cancers. Then what is the aspect of Ayurveda in cancers? In Ayurveda, we have two words. One is Granthi and Arbuda. Normally, we can correlate the Granthi are benign tumors and Arbuda are cancerous. That means malignant. Then Vata, Pitta, Kapha, when aggravated, may develop malignant tumors. Have given Sussuta Acharya. And specially aggravated Kapha and Vata dosha. That means Kapha means it's making more cells, and Vata means it's the velocity of the cell division make fast. Then this affect the tissues and result in developing a malignant tumor. Then what are the features of Arbuda? If we take Arbuda, mostly they are starting as round in shapes, but after that maybe change its shape in unusual shapes, then firm in consistency, then causing mild pain. Most of the time at the beginning there's no pain, but the late time it may be cause mild pain, and the size may be large and deeply rooted in the body. Because of that, it may be fixed to the part of the body. Then slow growth, mostly comparatively other cyst and all, may be the slow growth having. Then no suppuration and swollen fleshy growth. Then what kind of tumors? Sussuta have told that benign, he has told Medaja Arbuda, Kapaja Arbuda, Pittaja Arbuda and Vataja Arbuda. The same time he has mentioned malignant, that Mamsa Arbuda and Rakta Arbuda. Then Mamsa Arbuda occurs when muscles get disrupted from fighting. For instance, when from the punching the muscles show a swelling which is stony hard, painless, glossy, immobile, without inflammatory signs of the same color as the surrounding is the tumor. This form is more common in non-vegetarians, and Mamsa Arbuda is extremely difficult to cure for the same reason as Rakta Arbuda. Then what are the Rakta Arbuda? They occur when aggravated dosha hampered blood vessels in their functioning, impeding the blood circulation as well. This leads to disturbance in the blood comparable to the accumulation of toxins, especially that armor in the blood. These toxins can be the cause of tumor. Then when tumor develop in the blood vessels, they are spreading through the blood, and lymphatic system will soon become reality. Actually, that cancer can spread in 6 ways, but spreading is very fast with blood and lymphatic. Then this large spreading of tumor recovery extremely difficult. That's why that cancer is so difficult to treat. Then symptoms of blood tumors: little fluid or pus accumulation around the tumor, grow quickly, covered with small metastases and secretions of disturbed blood. Then this is very difficult to cure. Then forms of metastasis according to Sussuta. He has mentioned 3. That means Rakta Arbuda, when a tumor is surrounded by small tumors. That means in one place, that cancer consists of small few tumors. Then Dvi Arbuda, when 2 tumors arise at the same time. Here you can understand sometimes some patients having that breast cancer, the same time they may be having some cancer in the uterus or the ovary. Likewise, that means they have both are started in the same time, but in two places. Then Adyarbuda. Adyarbuda means development of another tumor over the first tumor, or when a tumor arises on a pre-existing site or near primary tumor. That means what we are telling metastasis these days. That means it started from one place, and after some time it may be spread to the other place, and it's arise from other place. Then what is malignant tumor? Then tumor cause large secretions of fluid in the surrounding tissue, are located in vital locations or channels, or tentaciously attached to the surrounding tissues, are highly difficult to cure. Then malignant tumors do not suppurate and do not excrete fluid, blood or pus anymore. Mostly if it started with pus or blood also, but later it has no any secretions or any fluid. They are no longer removed by the body, grow quickly and cover a large area. That means what we have explained earlier also, it will spread and grow very fast. They are caused by the 3 vitiated dosha and always affected muscle tissues, adipose tissues, and blood. Then while we are talking, we can't forget that triguna of the mind also affect the cancers. Not only the body functions, but also the mental functions also contribute the development of tumor. When someone is blocked in his development for some reason, he may become frustrated. This will imbalance the mind and leads to all kind of symptoms like hyperactivity, lethargy, indifference, or even depression. Then Ayurveda refers to as tamasika, the negative aspect of tamas. Tamas has a strong resemblance with kapha dosha. When a chronic disease such as cancer develops, tamas and kapha can reinforce each other. Ayurveda considers psychotherapy as a meaningful part of the treatment. Health can only be attained through the balancing body, mind, and spirit. That's why in Ayurveda we have considered about the mental condition, and we have given a kind of treatment modalities for cancer. Then we have to see what is the breast, and just a small introduction. The breast is on the upper ventral region of primates on both sides, containing the mammary glands. Female can secrete milk for feed infants. Modified sweat gland lying on pectoralis fascia and musculature of chest wall and surrounded by skin and subcutaneous fats. Breasts are the most superficial structure in the anterior thoracic wall. Then both man and woman develop breast from the same embryological tissues. At puberty, female sex hormones, mainly estrogen, promotes breast development, which does not occur in men due to the higher amount of testosterone in the men's blood circulation. So woman's breast become far more prominent than men. Here you can see what are the parts of the breast. One, that chest wall. Then 2, you can see that orange color, pectoralis muscles. Then 3, that lobules in brownish color. Then 4, it's the nipple. Then 5, that areola. The 6, milk duct. And 7, fatty tissues. And 8, skin. Then the ducts leads to the nipple located at the level of 4th intercostal space in the center of the dark circular pigmented area of skin called the areola. Areola is rich in modified sebaceous glands, a secrete or oily lubricant to nipple and areola. Why I mentioned specially about that areola and the nipple? Because in the breast cancer, we can see a lot of changes in nipple and areola. Then we have to consider about the development of the breast in the utero. The breast beginning to develop in the utero at around 6 to 7 weeks after post-conception. At about 16 weeks, the cells beginning grouping for the lactation glands of the breast, it's called lobules. Over the next several months, the inner workings of the fetal breast will develop and define. During the last 2 months before the birth, the lobules will beginning to produce and fill with yellowish, clear or sometimes oily milky substance called colostrum. This is a result of the mother's hormones crossing the placenta during the last trimester of the pregnancy. Then we have to consider about the development of the breast after the birth. After childbirth, colostrum will reabsorb or leach out of the child's breast through the nipple. Both genders develop colostrum and have identical breast structures until puberty. Then after the puberty, until pre-pubescence, both genders' breasts are the same. At that time, the female body produces estrogen, then progesterone, which stimulates the sexual maturation process. While the ovaries are maturing, the breast undergo significant changes themselves. The breast will enlarge and develop more fully from 3 to 4 years. Menstruation usually beginning within 2 years of breast development. Then the breast size. This is also very important because most of that breast cancers, it changes the size of the breast. That's why we have to know the normal situation of the breast size. Breast size can be vary from person to person, although several deciding factors. That means all are not having same size breast. It is depending because of amount of breast tissues, body fat percentage, then hereditary, then in pregnancy, and at the age. In pregnancy also they are having fullness of breast, but after the pregnancy and after the breastfeeding, they will come to the normal size. Then after the breast enlarged due to pregnancy, yeah, it's shrinking postpartumly, called involution. Then what are the other causes of changes of the breast? That is having breastfed. Because of that, either the breast may be smaller or bigger, and estrogen and progesterone supplementation in form of the shots, then implantation breast, then because of various medications they have taken long, then hormonal disorders, then because of the menopause and late ages of the age. Then whether breast is symmetry or not. Most of the patients having these problems, they are telling one of my breast is bigger than that. But in that breast cancers even, they can see one breast is bigger than that. That's why we have to consider about this symmetrically. But we know 99% of women breasts are not symmetrically. The breast have different volume of different components, then more tissues, less fats, large lobules, more connectivity tissues. Then according to Charaka, what is Stana Sampat? That means features of ideal breast. It should not be situated at very high level in the chest, should not be too long, should not be lean, not be too plump, should be attached with nipple of a proportional size, and child should find it easy to suck them. These are the Sthana Sampat according to Charaka. Then what are the symptoms of breast lumps? Actually, maybe having various kind of breast lumps. So we have to consider what are the symptoms of breast lumps. Change in the size, shape or feel of breast. That means after have gone through puberty. Then maybe dimpling, puckering or redness of skin. Then lumpiness, thickening of breast. Changes in the appearance of nipple, discharges from one or both nipples, swelling or lump in armpit, pain that doesn't go away in one part of breast or armpit. Here you can see some kind of nipple discharges. According to nipple discharges, we can do some kind of diagnosis. Discharges characteristics multiduct, uniduct, bilateral or unilateral. If it is milky, it may be prolactinoma. If it is green, that mammary ductaceae. If it's black or blood stain, duct papilloma. Always uniduct, always unilateral, clear, mucoid are breast cancers. Then breast self-examination. That is more important thing, because before you go to the doctor, you have a responsible to examine your breast around after your puberty. You have to start the breast examination. Actually, you can select days for that. If still menstruation, then the best time is when breasts are least likely to be tender or swollen a few days after the menstrual. If menopause, then pick a certain day, such as the first day of each month of the calendar. If taking hormones, at that time also you can't see that regular menstruation. At that time, take with healthcare provider and decide the days. Then here I am showing while you are examining your breast, what are the points you have to consider. You can divide it 4 parts in your breast. That means superior lateral, inferior lateral, superior medial, and inferior medial, and especially nipple and area, and axillary process. Then while you are examining your breast, started in front of mirror. That means you can't see your naked eye. Better to go in front of a mirror to large enough to see breast clearly. Then check each breast for anything unusual. If you have very familiar with your breast size, shape, and color, you can understand very easily any unusual things arise from your breast. Check the skin for puckering, dimpling, or scaling. Thus, look for the discharges from the nipple. Then watching closely in the mirror, clasp hand behind head and press hand forward. That means you have to examine your breast in various positions. Then next, press hand firmly on hips and bend slightly towards the mirror as pull shoulders and elbows forward. Do steps 2 and 3 to check for any changes in the shape or contours of breast. As do the steps, should feel chest muscles tighten. Then gently squeeze the nipple and look any discharge. Then the breasts are best examined while lying down, because it is spread the breast tissues evenly over the chest. Lie flat on back with one arm over head and a pillow or folder towel under the shoulder. This position flattens the breast and make it easier to check. Then check with healthcare provider if you find any changes in your breast. That means development of any lump, a discharge other than breast milk, swelling of the breast or locally or generally, and skin irritation or dimpling, nipple abnormalities such as pain, redness, scaling, turning inwards, etc. Then here you can see what are the features we have to consider while you are doing your breast examination, what I mentioned earlier. Then what are the Sthana Roga mentioned in Ayurveda? Sthana Shula, Sthana Shofa, Sthana Granthi, Sthana Arbuda, Sthana Vridradi. Here you can see in allopathic way what they have given, that fibroadenoma, then cyst, then abscess, then fibrocystic diseases and tumors. The tumors we can correlate with Sthana Arbuda. Then Nidana for Sthana Arbuda. Age 45 and in between 55 years, common to have that breast cancers, and maybe in old ages even. Then early or late menarche, early or late menopause. If they are having irregular menstruation, if they're having high BMI, especially more than 35, and not given breast milk to children, or not given birth to children, or delay to have children, and any trauma to breast, and any family history of any cancer or breast cancers, and tight, non-cotton and dark color clothes wearing for long times, then often razor the axillary hairs and using deodorants, and because of junk foods and instant foods. Then what are the samprapti of Arbuda? Vitiated dosha, mainly kapha, enters the affected dhatus, vitiating mamsa, rakta, and medas. Then abnormal vitiation of dosha and dusha followed by their accumulation at one place. It has protuberance like joint of bamboo, joint between two parts of plants or kernel of fruit of amalaki, and it is relatively hard and rough in touch. Then according to Dalhana, they have given two ideas. Aggravated dosha involving mansa and rakta leads to vataja arbuda, pittaja arbuda, and kafaja arbuda. Then how it's that medaja arbuda forms? Because of aggravated vata dosha mixed with meda and kapha. Then what are the samprapti ghataka of granthi or arbuda? Dosha, kapha, pradhana tridosha, dusha, rasa, rakta, and mansa, agni, jataragni, datvagni, mande, shrotas, raktavaha shrotas, rasavaha shrotas, mamsavaha, artavaha shrotas, shroto dushti, sangha, and ati pravrutti, uddhavasthana, amapakwasha, roga marga madhyama, sthana samshraya sthana, and vyakti sthana. Then while we are taking medical history as a doctor and while doing physical examination, what are the points we have to consider? While questioning, we have to ask about symptoms, any other health problems, and possible risk factors for benign breast conditions or breast cancers. While doing examination, we have to see the texture and the size of the breast, relationship to the skin and the chest muscle, that means whether it's fixed or not, then any changes in the nipple or the skin of the breast, then lymph nodes in armpit and above collarbones may be palpated because we have to exclude the metastasis. Here I have mentioned symptoms of breast diseases. You can see the lump, pulled in nipple, dimpling, dripping, redness or rash, and skin changes. Then modified multidisciplinary triple test. While we are doing testing, they have given special 3 tests. That is pre-procedural diagnosis of palpable breast lump. That means if any patient comes with the breast lump, we have to go for clinical examination, imaging, and biopsy. Then diagnostic modality of breast abnormalities. That means if any suspected breast abnormality present, then we have to go for radiology. That means mammogram, ultrasonography, magnetic resonance imaging, PET. Then pathologically, FNAC, core biopsy, surgical biopsy, etc., and tumor markers, ER, PR, HER2, etc. Other than that, genetic studies, we have to see BRCA1 and BRCA2, whether they are containing hereditary, and serum markers CEA, CA15 to 3, then CA27 to 29. Then for detection breast diseases, there are a large number of investigations. Most of them are coming under CA breast investigation. That means always if a breast lump is present, we have to consider about the breast cancers. Then what are the investigations for carcinoma of breast? Especially if it's a suspected carcinoma of breast, what we have to do, that we have to go for mammogram, frozen section biopsy, core cut or true cut biopsy, wide bore needle biopsy, ultrasound abdomen, estrogen receptor study, MRI of breast, FNAC, chest X-ray, etc. That means we have to exclude any metastasis also at the same time. Then more than that, according to the situation of the patient and according to the time of the condition, we have to go these kinds of investigations according to the needful. Then we have to consider that normally where is the location we can see that breast cancers commonly. Upper outer quadrant may be 50%, and that inner upper quadrant may be 15, then outer lower quadrant 11, and inner lower quadrant is 6. But that nipple is in the second place, nipple and the areola, that may be 18% of cancer may be happen. Here also I have shown what are the conditions of the breast. You can see when patients come with actually breast cancer stage. It's not suspected mass or any cyst. At that time, the patient come with these retracted signs, then edema of the skin, that means lemon peel appearance, then nipple retraction and deviation, and abnormal contractor. You can understand very nicely while seeing this. Then carcinoma, tumor markers for breast. That means carcinoma, we can see various tumor markers according to the place. We can see various kind of tumor markers, especially CEA, HER2, UPA, PAI1, then oncotype DX, mamma print, etc., especially for breast cancers. Then we have to see what that Ayurveda concepts have told about treatments. They have three main folds actually. Antaparimarjana, that means dosha dushi in Sarvadeshika. Then Bahira Parimarjana, that means local dushti or dosha or dusha. Then Shastra Panidana along with Nidana Parivarjana. Then what is the treatment protocol we have to follow here? Especially that Langana Karma, Agni Deepana, Amapachana, Shodhana, Shamana, Tarpana, and Rasayana Karma. We all know because of that kapha and vata, that lump may be increase the size very fast. But if you do proper Langana Karma, including Udvartana, etc., you can slow the progressing of the breast lump. And we know because of Ama, most of the time that cancer even started. So we have to do the Agni Deepana and Namapachana, and we have to remove that Dushita dosha, and we have to balance the remaining dosha, that means Shamana. Then we have to do the Tarpana and Rasayana Karma for the further prevention. Then treatments, again, we can see in detail by Sajja Chikitsa, that Abhyantara Chikitsa and Bahya Chikitsa. Abhyantara Chikitsa we can divide it into two, that Shodhana and Shamana. In Shodhana we can do Virechana, Basti, Vamana, Raktamokshana, etc. according to the situation of the patient and all other things. Then Shamana, Amapachana, Agni Deepana, Shroto Shodhana, Ojo Vriddhikara, and Rasayana. In Bahya means local, we can do that Swedana, Lepa, Upanaha, Vimlapana, Pachana, etc. Then not more than that, in Susuta also mentioned that Shalya Chikitsa we can do for that breast diseases, especially Shastra Karma, Chedana, Lekana, Visravana, Apaharana, etc. Then Anushastra Karma, we can go for Agni Karma, Shara Karma, Raktamokshana, etc. Then earlier also I mentioned that cancer, not only breast cancers, all of the cancers may be having a relation of with mental status. Because of that, we have to ask that patient to do meditation, yoga, relaxation techniques, breathing techniques, other than while we are treating Shoto Hara, Granthi Hara, Brana Upakrama, and Lekana Karma. Then what are the medications and why we are using these medications? Then earlier also I mentioned they have aggravated vata. Because of that, we have to do vata shamana or anulopana. And if they are having shula, then we have to do the shula hara chikitsa. Then we can use dashamula kashaya, dantimula kashaya, yogaraja gugulu, vata gajendra singha vati, narayana taila matra basti, nirgundi taila local application, etc. Then we have to do that Granthi Hara Chikitsa. For that, we can use Varuna Kashaya, Panchanara Gugulu, and Chandraprabha Vati. Then Shota Hara Chikitsa, because we have to reduce the swelling of the local place. Then for that, we have to use Purannamashtaka Kashaya, Kaishora Gugulu Vati, Dashangalepa application, then Punarnama Gugulu, etc. Then Amapachana Agni Deepana, we can use Danya Panchaka Kashaya, Bilvadi Kashaya, Panchatikta Kashaya, Panchakola Fant, Agni Tundi Vati, Hinguashta Churna, etc. Then Virechana, actually we have to do that Nitya Virechana mostly. Then we have to use Triptadi Kashaya, Triphala Kashaya, Triphala Churna, Manibhadra Churna, Datri Churna, Sukumara Churna, etc. Then Kapha Hara. Earlier also I mentioned it is more prominent Vata and Kapha. Because of that, we have to do Kapahara Chikitsa. For that, we can use Daruparpata Kashaya, Sitofala Churna, Talisadi Churna, Sharkaradi Kalka, Buddharaja Kalka, etc. Then as Rasayana, we can use Chavana Prashavaleha, Pushpandaleha, Haridra Kanda, Trifala Churna, Ashwagandha Rasayana, etc. That is mostly after the subside of the problem. Then not only that preparative medicines, we can use various kind of herbs also. That is mostly available in their home gardens also. This helps total healing, maybe reduce the side effects and cancer associated complications, because that patients may be having associated complications also. For that, we can use these kind of herbs. Here I have mentioned a lot of herbs you can use maybe as day-to-day use, even not as medicine also. Then we have to do that Nidana Parivarjana. Earlier also I mentioned, if any Nidana is there, we have to do that Nidana Parivarjana, especially harmful radiations and chemicals we have to avoid, and we have to protect from them. And mental factors, we have to correct them. And Apatya Ahara, we have to prevent from them, Apatya Vihara even, and special addictions we have to stop. And Apatya Aushadha, if they are having prolonged Apatya Aushadha, they have to stop them. Then what are the Ahara Apatya? That processed meat, red meat, alcohol, dairies, fried foods, overcooked foods, salted fish, sugary drink or non-diet, soda, fast food or processed foods, sugar and refined carbohydrates, sweets, biscuits, flavored milk packets, and fizzy drinks. Then these are the natural foods you can use apart from those foods. Here you can see what are the natural foods. Then Ahara Patya. Then fruits, you can use berries, pomegranates, grapes, sour soup, etc. Then baby jackfruits, bitter gourds, broccoli, red onion, green tea, then Indian ginseng, red spike thorn, etc. You can use as Patya Ahara. Then Vihara, that means what are the Patya Vihara? Avoid stress, avoid smoking, avoid alcohol, avoid day sleep, avoid postponing natural herbs, that means Adharaniya Vega, avoid carbohydrates, proteins, oily foods, heavy foods, then drink plenty of water, take meals at correct times, then maintain healthy weight. That means you have to maintain the BMI correct according to your age, and regular exercises, and night sleep, especially 10 p.m. to 4 a.m. Then what is the summary of the topic? If you use herbs, they may be helps to healing, reduce the side effects, decrease cancer-associated complications. While doing treatments by a doctor, it may be relief from symptoms, prevent from side effects, decrease cancer-associated complications. Then if you use Patya, it prevents the conditions and health promotion. Then this is my conclusion. Early detection of breast cancer help for save life, proper treatments, reduce unwanted suffering, save money. Thank you very much. Good night.
Thank you, madam. Thank you so much for your nice presentation. It's a very elaborative, at the same time covering all the areas related to the not only the anatomy and physiology of the breast as such, size, shape, all the related orders, disorders, everything, along with the symmetry, everything, and then the onset of cancer, right from its stage of Granthi to Arbud. You covered all the areas very well, and the way it is being managed is also been taught. Early detection, best results. This is the take-home message from your side. It should be regularly examined, and if at all any doubt is there, the concerned doctor should be consulted, and the proper guidance be followed by the patient. This is what the assumption. Very nice presentation. Thank you so much, ma'am. Thank you. And please do join on our very auspicious day on tomorrow. Definitely it will be a millennium day for the IRES platform for completing 1000 episodes of webinars on tomorrow. Thank you so much, ma'am. So now our next guest speaker of today's on the same topic is our very strong pillar, Professor Vaidya Parul Joshi ji. She carries a lot of distinctions with her and having a great authoritative attitude over the subject, may it be of any, say, sector of the body, anatomy, physiology, and pathology. So I welcome her to this platform to listen a lot of good information which she might have managed by evening to pour the knowledge to this platform as a pre-evening, I should say, the Purva Sandhya of our 1000th webinars auspicious day on tomorrow. So welcome, ma'am. Thank you so much. Namaskar.
Namaskar. It was a wonderful presentation, madam. Congratulations from me. The Ayurvedic concept of breast cancer is my topic today. And this October month is dedicated to breast cancer. So from that, we can understand how much serious the WHO is and how much serious our Indian government is. आज सब मैं बहुत प्राउड फील कर रही हूँ. फर्स्ट टाइम इन द हिस्ट्री ऑफ इंडिया हम एशियन गेम्स में 100 मेडल्स लाए हैं और नीरज चोपड़ा जी जो है वो प्राउडली अपना नेशनल फ्लैग दिखा रहे हैं जब उनको गोल्ड मेडल मिला चाइना में 4 अक्टूबर को. और आज का स्वाइन यानी स्पोर्ट्स अथॉरिटी ऑफ इंडिया का ट्वीट है, दैट इज मेडल 100 फॉर इंडिया. History is made as India gets its 100th medal at the Asian Games 2023, testament to power of dreams, dedication, teamwork of our athletes involved in achievement of Team India. Let this achievement inspire generations to come, showing that with hard work and passion, anything is possible. And that is today's my message to everyone who is suffering from breast cancer. You can overcome it. You can win. Nothing on earth is impossible. So as Neeraj Chopra ji is showing his gold medal, same way you can show that you have eliminated cancer from your body. So the breast cancer awareness month of October is a global event where breast cancer, we talk about breast cancer and we talk about the causes and how to eradicate and how to come out of this problem, and that can be done only when we together we rise. So don't delay, get your screening today. And since breast cancer represents 1 in 4 of all cancers in women, understand the seriousness that you need to take care of your breasts from the time they start developing. So aim to educate, inform people about breast cancer, its risks, and the importance of early detection and support for those affected. Luckily, Ayurveda can help you in the first 3 stages of breast cancer. Now, what is a breast? So they say noun, it's a noun and all that. But even the Merriam-Webster dictionary is not able to define breast normally. But when we come to our medical aspect, it's more clearer than this grammar people. Breasts are most prominent superficial structures in anterior thoracic wall consisting of glandular tissue, supporting fibers, and fatty matrix. So these are the ground substances constituting the breast. The skin is their outer cover. So this circular body and nipple in the center is surrounded by pigmented skin area called the areola. This nipple and areola are supposed to be very vital in a female breast, because when she starts lactating, she will be able to feed her baby only through them. And it is the same part which shows that there is some disturbance in the breast. So this areola and nipple area should be examined, and it's my view and my experience that don't try to just keep on checking your breast often. That irritates the tissues, and that should not be done. So, as Madam said, I put the same slide here that during pregnancy also there are breast changes, the size increases, the firmness of the breast increases, the appearance changes, the nipple color changes, there is discharge through the nipple, and there is sensitivity. So people sometimes start thinking that, oh, I am having cancer with this pregnancy. No, it is not that. They have pregnancy changes. But as Madam rightly said, that if they persist even after delivery and even after weaning of the baby, then you need to consult your gynec. So the lymphatic glands around the breast are very important. They protect the breast, the tissues of the breast, the areola and the nipple. They are very important, and their health has to be maintained. See, in lobular carcinoma in situ, you can see that the cells, this is the normal lobule. These are the lobules, right? The glands form from that, and from there, the lactation comes to the nipples. So these lobules, if they are irritated, then they go into lobular carcinoma. See, you can see this. Here you can see they have shown here the lumen. So this is from the anterior posterior, and this is from the lateral aspect. Here, how to examine your breast. So if you are doing your breast examination in lying position, you need to examine your breast like this, and like this. So in these three lines, you are able to understand that there is no deformity or any growth in your breast. This way, if you examine your breast, you may misinterpret. If you are in the ovulatory phase, pre-ovulatory phase, premenstrual phase, then your breast may be harder than normal. In those times, you may be misinformed if you are palpating your breast like this. So the best way is to palpate your breast like this in all the four quadrants as Madam has shown, and that should help you. Now, has Ayurveda talked about breast? Yes. Purushebhya adhikaschanye narinam ashayastraya dharagarbhashaya proktah stanau stanyashayo matu. Now, according to modern science, menstruation and breastfeeding are different. According to Ayurveda, no. And that we can see in the hormones also, that lactational hormones coincide with the menstrual hormones and ovulatory hormones. If that feedback mechanism is not maintained, then the menstruation and ovulatory cycles are disturbed. The same thing, Ayurveda has said that Rasa has two upadhatus. One is Artha, the other is Stanya. They have mentioned Artha first. And even in a cancer, we have seen that there is a history of abnormal menstruation. So here you can see, as Madam has shown already, here you can see that itchy breast, warmth in breast, redness or rash that covers at least 1/3 of the breast. Nipple is retracted. Breast skin looks like orange peel, or there is sudden increase in breast size, and there is a bit of hardness. It's not normally soft. Then you have to go and meet your doctor, gynecologist. The treatment depends on the stage of disease, whether it's chemotherapy, radiation, or hormone therapy. Here, in short, they have given that heredity, lifestyle, age, obesity, pregnancy, and breastfeeding. I will say that the woman who has not taken proper care during her Rajaswala time, that is menstrual cycle time, during her ovulatory time, during her pregnancy time, during her delivery time, post-delivery, during feeding, and during weaning, is going to land herself in trouble. The first trouble will start with her menstruation, then will start with her psychological behavior, her anger and all that, and then she will develop breast tumor. So now, tumor comes first, and before that comes edema. So it takes months, sometimes years for a tumor to form. But if you have etiological factors that can aggravate the tumor, then the tumor develops very quickly. And if you are not able to control your emotions and your stress factors, then you're definitely going into cancer. So cancer is not an easy disease. It takes years for it to form. So that is the main point you need to think over and need to take care of. So the lump that feels different from the rest of the breast tissue. There's a rash around the nipple, the discharge from the nipple, pain or tenderness in the nipple, but it is not mandatory. Many patients I have seen, they don't have any pain or even tenderness, but suddenly the husband says that he feels like a lump there, and then they come to us. So the swelling is the main symptom here. See, you can see here that this is the way how surgeons say that this is stage 1, this is stage 2, stage 3, stage 4. So consequently, the tumor keeps on developing, but it can be retarded at any stage and it can be reverted into normalcy. See, if there is a cyst in the breast tissue, you can see it like this. So here they say that a mammogram, you need to go for a mammogram. But you can see here that a sonography is better than a mammogram. Mammogram does not speak much, but sonography definitely tells us the location, the type, and the size. So that should help us. So lumpectomy, breast reconstruction, they are all very good things. We can assure the lady that yes, everything can be done. You can come to normalcy, but that will not be her normal feature. It will be an artificial feature. So if you don't want that, then try and understand what Ayurveda says. So Ayurveda starts with Shodha, and Madhav has talked about Samprapti first. So what he says, रक्तपित्त कफान वायु दुष्टो बहिः शिराः नीत्वा रुद्ध गतिः तैः कुर्यात् त्वं मांस संश्रयम् उस्सेद संहतं शोथं तमाहुः नीचयादतः सर्वं हेतु विशेषैस्तु रूप भेदान्नवात्मकं दोषै पृथक् द्वयैः सर्वैः अभिघातात् विषाद अपि. So what he is trying to say, I'll talk in Hindi also. वातादिक दोष बढ़कर और मेद तथा सीरा खराब होकर मांस रक्त को खराब कर गोल गोल गठिया शोथ यानी ग्रंथिपुत शोथ पैदा कर देता है. इसलिए गंठीला शोथ होने से इसे ग्रंथि रोग कहते हैं. पूर्व रूप तत्पूर्व रूपम दवथु श्वथ, श्वयथु भी उसका पर्याय है. सीरायाम अंग गौरवम, अंग का गौरव यानी जहां पर भी शोथ उत्पन्न हुआ है वहां पे हमें गौरव की अनुभूति होती है. वहां शोथ की यानी उपसा हुआ है, जो उसका नॉर्मल शेप है उससे उसका साइज बढ़ा हुआ है. फिर बताते उसका निदान क्या है. मैं इसके ऊपर ज्यादा जोर देना चाह रही हूँ क्योंकि ये जो बातें हैं कि क्यों जो हमारे आचार्य है उन्होंने इस तरह का वर्णन क्यों किया है और उस वर्णन का महत्व जो है वो हमें समझना बहुत जरूरी है. यहाँ पे बोलते हैं शुद्धामया भुक्त कृशा वलानाम क्षाराम्ल तीक्ष्णोष्ण गुरूप सेवा दधियाम मृच्छाक विरोधी दुष्ट गरोप सृष्टान्न निवेशनम च अर्शांसी अचेष्टा न च देह शुद्धि मर्मोपघातो विषमा प्रसूति. मिथ्योपचार प्रतिकर्मणाम च निजस्य हेतु स्वयथो प्रतिष्ठ। देखिए साहब, पहले इन्होंने संप्राप्ति बताई, फिर पूर्व रूप बताया, फिर निदान बताया, फिर सामान्य लक्षण बताया। ये क्रम बहुत समझने की बात है। तो कारण जो है, निदान जो है, उसके अंदर वे बोलते हैं कि शुद्धि, आमय की जो शुद्धि करनी है, तो उसमें क्या करते हैं, वमन विरेच निरुबस्ती के द्वारा जो देह शुद्धि हम करते हैं, उसके कारण, रोग के कारण, किसी और रोग के कारण, जैसे कि हम डायबिटीज देखते हैं, ब्लड प्रेशर देखते हैं, तो उसी तरह उपवास, ज्यादा उपवास करने से, अविधि भोजन जो अष्टविधि बताई है उसका उल्लंघन बार बार करते रहना, इन सब कारणों से कृशता और दुर्बलता हो जाने पर क्षार, अम्लता, तीखी चीजें जो है उनका देर से हजम होने वाली जो हमारे बताई है दधि, अम्ल आदि, उनका जो है अत्यंत सेवन करना, फिर शरीर में आम उत्पन्न हो इस तरह का हमारी लाइफस्टाइल रखना, मिट्टी, मृत, शाक, अन्नमेल के पदार्थ विरुद्ध जो है हमारे दूध और दही, दूध और मच्छी, दूध और खटाई, इस तरह का जो है रात में दही खाना, फिर दूध फ्रूट के साथ खाना, नमक के साथ खाना, ये सब जो है वो विरुद्ध है। इसके बहुत बड़ा लिस्ट है, उन सभी का सेवन हम बार बार करते रहते हैं। शाक का अत्यधिक सेवन करना, ये तो मैंने भी देखा है कि जिन महिलाओं में शाक का ज्यादा उपयोग होता है, यानी कि सलाड्स का ज्यादा उपयोग होता है, पत्र शाक जो है सलाड के रूप में ज्यादा यूज करती है, उनमें मैंने देखा है ब्रेस्ट कैंसर की टेंडेंसी ज्यादा रहती है। कभी उसके डिटेल में तो जाना पड़ेगा, रिसर्च टॉपिक हो जाता है। फिर गर्भ संयोगज विष युक्त जो आहार है हमारा, तो विष युक्त आहार यानी जो वो तो हम लोग खाते ही हैं, रसायन युक्त ही हमें तो दिया जाता है, जेनेटिकली म्यूटेटेड अन्न ही हमको कंपल्सरी खाना है। तो ये जो है उसको छोड़ के हमें ये समझना चाहिए कि जो ऑर्गेनिक है, हमारा देशी जो धान है, उसको हम सेवन करें ताकि हम इसमें से बाहर आ सके। फिर जो है कि दुष्ट दोषजनक खराब पानी का सेवन, बवासीर के बारे में कोई सोचता नहीं है, और बवासीर जो है वो लिवर फंक्शन डिस्टर्ब होने के बिना होते ही नहीं है। फिर चेष्टा न करना, ये जो आज की हमारी दिनचर्या हो गई है उसकी वजह से भी देह शुद्धि न करना, मर्म उपघात होना, ये तो देखने को मिलता ही है। जो जिसमें हमें ये सब निदान नहीं मिलते हैं, उनमें अभिघात का निदान मिलता ही है। विषमा प्रसूति यानी असिस्टेड लेबर जो है, मिथ्योपचार, मन मर्जी कभी भी शोधन करवा लिया, पित्त प्रकोप काल में वमन करवाते हैं, और शरद काल में जो अभी हमारा शरद काल चल रहा है तो उसमें बस्ती लेते हैं। एक तो मेरे पास बुजुर्ग आए थे 80 साल के, बोले मुझे पंचकर्म करवाना है। पंचकर्म में आपको क्या करवाना है? अरे पंचकर्म करवाना है, उतना भी आपको नहीं आता है क्या? अब काल तो देखिए, ग्रीष्म काल चल रहा है, ग्रीष्म काल में कौन सा पंचकर्म करेंगे? लेकिन हमारे में से ही कुछ लोग ऐसे हैं, वो बोलते हैं कि कभी भी हम पंचकर्म कर सकते हैं। तो ये हमें भी बोलना बंद करना चाहिए, और शास्त्र वचन जो है उसको हमें दृढ़ता से जुड़े रहना चाहिए। प्रतिकर्मणाम च निजस्य हेतु स्वयथो प्रतिष्ठ। तो ये जो है निदान, उनको भी हमें ध्यान में रखने चाहिए, ये सभी भी कार्सिनोजेनिक है। तो हम श्वयथु के सामान्य लक्षण देखते हैं तो सगौरवम स्याद अनवस्थितत्वम सोत्सेद मुष्माथ सिरा तनुत्वम सलोम हर्षश्च विवर्णता च सामान्य लिंगम श्वयथो प्रतिष्ठम। यही जो है वो कैंसर के भी पूर्व रूप बन जाते हैं, तो उसको हमें ध्यान रखना चाहिए। मैडम ने काफी डिटेल में बताया, इसलिए मैंने ग्रंथि प्रकरण जो है उसमें बहुत शॉर्ट कर दिया। तो ग्रंथि जो है वातज, पित्तज, कफज, मेदोज और सिराज आचार्य ने बताई है। लेकिन अर्बुद की जब बात कर रहे हैं तो वे रक्तार्बुद, मांसार्बुद, अत्यर्बुद की बात करते हैं। मैं उसके डिटेल में तो नहीं जाऊंगी साहब, लेकिन इतना जरूर बताऊंगी कि अर्बुद जो है और ग्रंथि भी जो है वो अपाकी होती है। भी रक्तार्बुद जो है उसको भी महर्षि ने अपाकी बताया है और सुश्रुत निदान स्थान 11 में बताते हैं न पाक मायांति कफादिकत्वान् मेदो बहुत्वात् विशेषतस्तु दोषा स्थितत्वात् ग्रथनाच्च तेषां सर्वाबुधान्येव निसर्गतस्तु। तो ये जो है उन्होंने बताया कि सब अर्बुद कफ के और विशेष करके मेद के अधिक होने से हर समय इन्हीं दोनों कफ मेद के बराबर रहने से दो विशेष स्थान है, मित्र और गला, उसमें नहीं पकते। और खासकर इन रोगों का स्वभाव ही होता है वे पकता नहीं, इस कारण से उनमें शोथ, बाकी के जो शोथ है वो पक जाते हैं। सब यहाँ पे मैं इतना बताना चाहूंगी कि स्तन जो है वो मर्म स्थान है। स्तन मूल, अपलाप, स्तन रोहित, ये जो मर्म है उनकी वजह से स्तन में हम कुछ भी कर्म करें तो बहुत ध्यान रखे करना पड़ता है, क्योंकि पीछे रहे फुफ्फुस में तुरंत ही तकलीफ हो जाती है। तो मैंने अब तक के जो मेरे पेशेंट्स है उनमें मैंने क्या उपयोग किया, मैंने व्हीट ग्रास दिया, त्रिफला चूर्ण दिया। मैं इनमें इन कैंसर पेशेंट्स में, नॉन कैंसर पेशेंट्स में मैंने कभी टैबलेट देना चाहा नहीं है। मैं चूर्ण देती हूँ या क्वाथ देती हूँ। ऐसा लगे कि पेशेंट बिल्कुल नहीं सह पाएगा तभी मैं टैबलेट देती हूँ, क्योंकि बाइंडिंग एजेंट है वो भी मेरी ड्रग जो है उसका इफेक्ट कम कर देती है। रसायन चूर्ण देती हूँ तो घृत और शर्करा के साथ देती हूँ। इनके साथ मैं पारंग्यादि क्वाथ देती हूँ, या फिर पेशेंट में अगर मुझे ज्वर के लक्षण मिलते हैं तो गुरुच्यादि क्वाथ, वो भी हमारा ज्वराधिकार वाला, वही मैं देती हूँ। चंद्रा प्रभावटी जो है उसमें नंबर 1 ही मैं देती हूँ, दूसरी कोई चंद्र प्रभावटी मैं नहीं देती। 2-2 गोली शुरुआत में 3 बार देती हूँ, फिर 2-2 गोली सुबह शाम 2 बार देती हूँ। रसायन भी होता है, शोधहरण भी होता है। स्थानिक लेब के अंदर लोग बोलते हैं दोषज्ञ लेब से रिजल्ट मिलता है, लेकिन मैंने देखा है दोषज्ञ लेब से बढ़ता है। आई एम टॉकिंग अबाउट ब्रेस्ट कैंसर ओनली, और किसी भी कैंसर की बात मैंने इस प्रेजेंटेशन में नहीं की है। तो कोई, मैं विनंती करूंगी कि कोई भी किसी और प्रकार के अर्बुद में इन द्रव्यों का प्रयोग न करे। फिर मैंने कांचनार और गुगुलू, ये जो ड्रग्स है उनका कभी इस्तेमाल नहीं किया। और एक बार ऐसी हालत आ गई थी कि मेरे पास, क्योंकि हम तो गवर्नमेंट स्ट्रेटा में थे, तो उस वक्त जो है वो कांचनार गूगल के अलावा कुछ नहीं मिलता था, न वरुण आदि क्वाथ, न पारंगी आदि, न गुड़ुची कुछ नहीं मिलता था। उस वक्त कांचनार गुगुलू दिया तो ग्रंथि जो है वो बड़ी, यानी अर्बुद जो है, कैंसर जो है उसकी ग्रंथि जो है वो बड़ी थी, इसलिए मुझे रिजल्ट नहीं मिला है। तो न मैं कांचनार का यूज करती हूँ न मैं गुकुल का करती हूँ। लेकिन जिनमें सिंपल ट्यूमर है या इडीमा है, यानी कि शुरुआत की अवस्था है और ऐसा लगे कि उसकी जेनेटिक हिस्ट्री है या फिर उसमें फैमिली हिस्ट्री है, तो उसके अंदर मैं बोलती हूँ कि अगर शुरुआत की अवस्था और ऐसा लगता है कि ब्रेस्ट हैवी हो गए हैं, तो मैं उनको बोलती हूँ कि निर्गुण डी का बाष्प स्वेद ले, वो भी कितना, 5 मिनट बस, उससे ज्यादा नहीं। स्तन को मैंने बहुत संभाल के रखा है। मेरे किसी भी पेशेंट्स में मैंने इससे आगे ट्रीटमेंट नहीं दी है। पेशेंट्स नॉर्मल हुए हैं, मेमोग्राफी भी नॉर्मल होती है, यूएसजी भी नॉर्मल होती है। उनका जो कैंसरस जीन और जो रिसेप्टर ये सब है उसमें केमिकली भी हमें नॉर्मल सी मिलती है। तो बहुत ज्यादा रसौषधि देने की या बहुत ज्यादा औषध देने की जरूरत नहीं है। एक बात तय है, पेशेंट को आप पे एतबार होना बहुत जरूरी है। इफ शी डजंट हैव फेथ इन यू, यू विल नॉट गेट अ रिजल्ट। तो यहाँ पे ये लास्ट जो है वो बोल के मैं अपना यहाँ पे समापन करूंगी। In 2011, US researchers looked at Vithaferin A, WA. It is a compound from Ayurvedic medicinal plant Withania somnifera, they found that Vitaferin A stopped the growth of some types of breast cancer cells in test tubes, not in humans. It also stopped the growth of breast cancer in mice, not in humans. और मेरा भी यही देखना है कि जब शतावरी नहीं होती थी तो मेरे जो सीनियर्स थे वे लोग अश्वगंधा देते थे, बोले शतावरी दो अश्वगंधा दो, दोनों एक ही है। मेरे मत से अश्वगंधा जो है टेस्टोस्टेरोन एलिवेट करती है, शतावरी एस्ट्रोजन एलिवेट करती है। तो मैंने कभी भी अपने पेशेंट में न अश्वगंधा दिया है न शतावरी दिया है। तो सबको मेरा नमस्कार, शुभ रात्रि, जय हिंद।
बहुत बहुत आभार मैडम, आपका बहुत बहुत आभार। आपका हमेशा से जैसा मैंने कहा कि आप बोलना शुरू करते हो हम लोगों पे सम्मान आ जाता है। थैंक यू थैंक यू थैंक यू। कल जरूर जुड़िएगा और लोगों को जोड़िएगा जी।
थैंक यू प्रोफेसर पंचम भाई, सही बात है, इसमें कोई शक नहीं। मैडम ने इतनी योग्यता और इतने न्यायप्रियता के दृष्टिकोण से सब कुछ बता दिया, क्योंकि एक तो सर्वाधिकार सुरक्षित है बीइंग लेडी, क्योंकि उनको इतनी गहराई से समय विषय की तो पकड़ है ही, लेकिन अपने क्षेत्र का विषय होने के नाते और भी अधिकार बढ़ गया। और कुछ चीजें अलार्मिंग बता दी, अगर इनिशियल और जेनेटिक बैकग्राउंड के नहीं है तो आपने अलर्ट कर दिया कांचना का प्रयोग और गुग्गलू का प्रयोग उतना फलदायी नहीं है, तो अवॉइड करना चाहिए, नहीं देना चाहिए, ऐसा मैं समझ पाया। हो सकता मैं गलत भी हूँ, लेकिन अन्य में आपने बताया है कि भरंगी चूर्ण या निर्गुंडगी का बहुत ही क्षणिक, हम तो क्षणिक ही कहेंगे, अल्पकालिक वाष्प स्वेद कराने की बात रखी है, ये हमें अच्छा प्रतीत हुआ। मेरी तो मदर भी कहती थी कि ब्रेस्ट कैंसर के, ब्रेस्ट के इनलार्जमेंट या इंगॉजमेंट ऑफ वेन्स के मामले में वो सिंपली ये कहती थी कि क्योंकि वो दुग्ध का स्थान है, इसलिए दुग्ध की भाप बहुत ही रिमार्केबल काम करती है। एक ऐसे बड़े कटोरे में दूध लेकर उसमें पानी मिला के और उसको बॉईल करने का था, जब उसमें से भाप निकलने लगती थी तो उस भाप के लिए बताती थी कि इसको करना है हल्का सा स्टीमिंग जो कहते हैं वो, और साथ साथ जो कंघा होता है ना कॉम्ब, उससे कहते थे कि ऊपर से नीचे निप्पल की तरफ हल्के हल्के हाथ से उसमें अगर हम एक लोकल मसाज टाइप जिसको कह सकते हैं करते हैं, तो कोई छोटी मोटी बिगनिंग की न्यूडल्स वगैरह कुछ अगर बन जाती थी तो रिजॉल्व हो जाती थी। प्रैक्टिकली हमारी मैंने नंबर 2 हमारी जो भाभी थी छोटे भाई साहब की मिसेज, उनको